This is a video demonstration to support techniques and procedures used in the book Korean Kinetic Acupuncture, Acupuncture's Next Generation Muscle Trigger Point Technique by Dr. Evan Mahoney. In no way should this be used by those without completed education, license, and degree in the curriculum of acupuncture and oriental medicine. Further training is recommended before one should begin practicing these techniques. The author takes no responsibility for mistakes or medical errors caused by those practicing these techniques. This video will not have needle insertion demonstration. For purposes of this book, these techniques should only be used for complaints of pain unless otherwise stated. It is to be understood that the practitioner using these techniques has a full understanding of acupuncture safety, contraindications, and proper needle location and insertion depth. This is a sample video demonstration technique for the Korean Kinetic Acupuncture technique. We're going to do a piriformis demonstration. So the patient would be exposed. We're not going to be exposing any part of the body here, but the piriformis generally it attaches at the greater trochanter of the hip, and then it runs in a kind of triangular pattern to the base of the sacrum and the top of the sacrum, or even the coccyx. So it runs in this direction. It's about along the medial glute areas, and so you can find the trigger point areas and insert the needles along the piriformis muscle, just like along a line here and here and here. So then, once the needles are in, you're going to take the patient's leg and interiorly rotate the hip. So right now I'm interiorly rotating the hip. The piriformis muscle stretches by interiorly rotating the hip. I'm going to ask the patient with the needles in place to externally rotate the hips by pushing the foot in a medial direction. But I'm going to resist that motion. So if you have your fingers without the needle, you can ask the patient to push. Make sure the patient pushes in this direction, that they're not pushing down towards the ground. So when the patient pushes, you can feel with your finger the piriformis muscle contracting. So go ahead and push. 1, 2, 3, 4, relax. And once again, the patient comfort with the needles has been assured. You've tested the range of motion with the needles in place. Internally rotate the hip. The patient pushes. Going to push. 1, 2, 3, 4, relax. And then you return the hip to interior rotation. Go in and push. 1, 2, 3, 4, relax. Relax. And go in and push. 1, 2, 3, 4, relax. And again, 1, 2, 3, 4. And you'll be able to kind of feel these muscles contracting. So again, the piriformis muscle, when we internally rotate the hips, that stretches the muscle. The piriformis contracts to exteriorly rotate the hip. So we're putting it in a stretch, we're asking it to contract, but we resist. So the foot doesn't move, the muscle contracts, and that will stretch the piriformis.